hold it.
You gotta hold the whole thing.
Hold.
Did you want her to push the red button?
Yeah. Can you see me?
Yes.
Yes.
Okay. Can you hear me?
Yes.
Okay. Thank you. Shut it off. Imagine that your child was injured or died in a wreck because they were not properly restrained in a vehicle. According to the CDC, the use of car and booster seats reduced the risk of serious injury by 45% for children between the ages of 4 and 8 when compared with seatbelt use alone. I have 3 children, and I will do anything I possibly can to keep them safe in any situation. The improper use of car and booster seats for children, or lack thereof, is a problem. I propose that we make the community more aware of the law and the recommendations and proper use of booster seats. Before we discuss a solution, we must first understand why car and booster seats should be used. The problem is that car and booster seats are used improperly, or also they are not used at all, per the appropriate recommendations and laws. According to the Centers of Disease Control and Prevention, buckling children in age and size appropriate car seats, booster seats, and seat belts reduces the risk of serious and fatal injuries. In one study of about 3,500 observed, 72% of car and booster seats were misused in a way that probably would increase a risk of injury during a crash. Drivers that do not wear seatbelts are a factor, and that 40% of children riding with them are also unrestrained. Now that we understand car and booster seats should be used, let's look at how they should be used. The Texas Transportation Code 545.412, a person commits an offense if the person operates a passenger vehicle, transports a child who is younger than 8 years of age, unless the child is taller than 4 feet 9 inches, and does not keep the child secured during the operation of the vehicle in a child passenger safety seat system, according to the instructions of the manufacturer of the safety seat system. It then goes on to the consequences. The best practice recommendations, according to the American Academy of Pediatrics, all infants and toddlers should ride in a rear-facing car seat until they are 2 years of age, or until they reach the maximum weight or height allowance by the car seat manufacturer. All children 2 years older, or the younger ones who have outgrown their rear-facing car seats limits, should use a forward-facing car seat with the harness up to the maximum weight or height allowed by the car seat manufacturer. All children whose weight and height is above the forward-facing car seat limit should use a belt positioning booster seat until the vehicle lap and shoulder belt seat fits properly. Typically, when they have reached 4 foot 9 inches in height and ages are between 8 and 12 years old. There are many more recommendations, but these are the main ones. Car and booster seats must also be installed properly to obtain the optimum benefit of the car seat and the crashworthiness of the vehicle. Let's take a look at how we can solve the problem. While there is already a law in place, pediatricians giving out information to their patients and car seat manufacturers providing the car seats with the appropriate specifications, we still need the uneducated to know how and why to use the car and booster seats. We also need the underprivileged to obtain and use the car and booster seats. The CDC said car and booster seat distribution plus education programs have been recommended. Even community awareness with information being passed out would be a positive in the right direction. In conclusion, the improper use of car and booster seats for children, or lack thereof, is a problem. As a community, we should all take action to make the car and booster seat distribution and educational programs on why and how to use the safety seats properly a reality. I do not want to watch the news and see that a child has died again because he or she was ejected from a vehicle because he or she was not properly restrained. So get the community together and sponsor a car and booster seat distribution along with printouts of the law and recommendations.
Pause.
No,
Pause.
no, let's keep our kids as safe as we can. Thank you. And show them. Don't forget to show them.